13 to 16-year-olds who attend alternative education because they have been excluded or suspended from mainstream education face greater barriers to accessing primary healthcare than their peers. They lack health and general literacy skills. They face practical barriers to accessing primary care, such as lack of funds and identification documents. As an adolescent nurse specialist at Nelson Bay's Primary Health, Leanne O'Brien runs health clinics that assess the health needs of every young person who comes into alternative education in the Nelson region. But let's hear the story from Leanne herself.
So my name's Leanne O'Brien. I'm an adolescent nurse specialist and I work in Nelson Marlborough region with alternative education students and also with our teen parent unit. And I've been doing this role now for the last 6 years in Nelson, and it's really valuable. So we have in Nelson around 40 to 50 students at one time who attend alternative education, and another 15 or so who attend the teen parent unit in Nelson. And so my role in working with those young people is to figure out what their health needs are and what are some of their unmet health needs, and how I can work with them to bridge the gap really. And for the young people that I work with, a lot of the health concerns that they have are quite complex. So we're looking at physical health problems that they may have, and also some concerns around drug and alcohol and mental health and sexual health.
The program was held over terms 3 and 4 and was made up of 6 one-hour sessions. Session 1 was an introduction to the program, what a family doctor is and what they do. Then the group looked at various reasons for seeing a GP and role-playing how to make an appointment.
Hi Medical Centre, how can I help?
Hi, can I please make an appointment?
Absolutely, when would you like the appointment?
Another important gap was documentation, checking if students had birth certificates, bank accounts, community services cards, and whether they were enrolled with a GP.
So when we got them some forms to fill out, a lot of them didn't know how to fill out the forms. Partly it was literacy issues, and the other aspect was they didn't understand words like next of kin or DOB for date of birth, or even a title of what they could be called, whether it's a Miss or a Ms or a Master. So a lot of that language that were in the forms people didn't know. So we spent a good session really actually going through what a form meant and how to fill that out.
Site visits to a practice to familiarise students with the clinic environment and to practice making an appointment with a receptionist was a valuable part of the program. As a result of taking part, students showed increased confidence in accessing healthcare. They recognised that seeing a doctor is an easy process and could fill out a form or navigate the clinical environment. Completing the programs also gives students literacy credits in oral language skills and filling out forms.
The outcomes for the program and the difference that it made for the students was about their understanding about how to access a GP. They certainly had a lot more confidence in knowing that a doctor or a GP was an okay person to talk to about anything.
The barriers to healthcare access faced by Youth Nelson students are likely to apply equally to alternative education students throughout New Zealand. Leanne plans to deliver the program again at Youth Nelson, as well as rolling it out to other education centres. She is currently training a colleague to deliver the program in Blenheim.